Morning. I was just thinking, I wonder how many people still, even 24 hours later, haven't put their clocks to the right time and maybe have got the wrong time for this morning. Good morning, Steph. Good to see you in. And Martin, good morning. That sounds lovely. Good to get away on the water. Right then, let's get going. So last week we did an introduction to the heart, and we were looking at all the different chambers of the heart and the flow of everything, where everything went to and from. So I'm going to do a little bit of a recap of that. Then on to the valves. Have a look at a bit closer in closer detail at those, and then the wider vasculature and how the heart kind of connects to everything, upper body, lower body. So that's the idea. Morning, Becky. Good to see you there. So that's the plan. Here is kind of where we finished up. So obviously quite a large, a lot of information in a picture here. Just get rid of that. There we go. Morning, Tris. Good to see you there, mate, as well. Right. So yeah, we were looking at the different sections, so the different chambers. We've got this right receiving chamber. So this is the right atrium up here. There you go. So if we go kind of round in anti-clockwise, I think. Well, let's start up here then. So we've got superior vena cava. So that's your deoxygenated blood from your head and your arms, upper body, draining into this chamber here, which is the right atrium. So that right side deals with deoxygenated blood, right side of the heart. This left side of the heart deals with oxygenated blood. And we've got various different either receiving or pumping chambers. So superior vena cava, so high, big vein, basically. That's what that one is. And it is a pretty chunky structure. And then I'm going to skip around a little bit to 6 o'clock from the clockwise, because we should bring this in here as well. So this is the inferior vena cava. So this one here and this one here, they both join together, and then that they create like a T junction, and that then goes into your right atrium. Okay. That they a lower receiving vessel and an upper receiving vessel, and they both join into that right atrium there. They do have their own openings, so they don't join together and then go in. They've got an opening each, which is what we saw last week. And then we've got this valve here. So this one here is a tricuspid valve. So it's got 3 cusps, so 3 flaps basically, and we were looking at then how they open. Saw a video of that last week. So we've got these papillary muscles down here. I think they're called something different on this video, on this picture rather. Oh no, they are papillary. Yeah, I saw them named as something different somewhere else. So papillary muscles, and then we've got your chordae tendineae, or your heartstrings, which attach onto those cusps. So when those papillary muscles contracts, they pull the cusps open to allow the blood into the next chamber. This here, fossa ovale, that was there's an opening in the embryo. So just before you're born, that closes up, and there's basically a gap between your or a hole rather between your right and left atrium, which then that's like a membranous tissue that then becomes a bit more solid over time. Okay, so you've got like an indentation on either side of the right and left atrium, which is a kind of legacy of that fossa ovale. So here we've got, so that bit there, the right pulmonary artery, that bit there, that is from this. Okay, so this is your pulmonary artery as well. So this one's going to the left lung, and that one wraps underneath this vessel here, so that's your aorta, and then that one goes over to your right lung. Okay, so that's your pulmonary arteries. Remember, arteries away, veins come in. So this one has got deoxygenated blood coming in through the vein, so the vena cava, and then out through the pulmonary arteries just there. Okay, so right atrium through the tricuspid valve into the right ventricle, and then that gets pumped up into here and then distributed to either lung. Okay, let's have a look as we go around. Yep, so we've got these little pectinate muscles on the inside of the atria just there, tricuspid valve, right ventricle, we've talked about that, chordae tendineae. The trabeculi is the heart muscle, okay, so the wall of the heart and the kind of shape that it makes, and then inferior vena cava. So that's all that side done. We did that last week, so just a quick recap today. We've got the visceral pericardium, so the heart is encased, and we're going to see this in a second, in a connective tissue capsule, and to protect it. And it's covered in visceral fat, as well as this kind of connective tissue layer. And it's there's an aqueous solution between that pericardium and the heart, so the heart can move around. It's a bit kind of slippery, and again you'll see that in a sec. You don't want things getting stuck together around this area, so it's nice and mobile. So obviously the heart is beating, the diaphragm underneath is moving, and then the lungs on either side are moving as well. So you don't want things getting stuck. Yeah. So these coverings make sure that the heart can move. Okay, so we'll have a look at that in a second. Myocardium is basically a heart muscle. Interventricular septum, so we talked about that. So in between the ventricles there's a divide. Septum is a hedge. So we've got this divide between the right and the left ventricle of heart muscle. Okay, there's your papillary muscle, same as on this side. Left ventricle, so this whole chamber. Then we've got the pulmonary semilunar valve, so that's coming back to this side. We've got semilunar, which is half moon, so a half moon shaped valve that is at the entrance to the pulmonary artery. So when the blood is pumped out of this right ventricle towards the lungs, as it's squeezed up into this tube here, these valves will open under the force of the blood coming through, and then they'll then close again with the weight of the blood if there's any trying to get back. Okay, so it doesn't filter back into the right ventricle. So yeah, that valve there is the pulmonary semilunar valve, and then we've got an aortic semilunar valve as well. So that's the entrance to the aorta, which is this vessel just here. And again, we covered all this last week, so just a quick recap. We've got the mitral or bicuspid valve. So this side we had tricuspid, so 3 cusps. This one we've got bi, so there's 2. And this is the divide between the left atrium and the left ventricle. Okay, so we've got the bicuspid or mitral valve on that side. Then these little vessels here, so those 2 there, and these 2 here, these are pulmonary veins, and you can see they're red, okay, which is useful, colour coordination. So these pulmonary veins, so veins come in, remember, so if you remember the I and N on the end of vein means in. So the right pulmonary, anything to do with pulmonary has got to be do with the lungs. So this is coming from the right lung, oxygenated this time into the left atrium. So there'll be those 2 holes there. They'll be the same on the other side, which you can't see. And then this these vessels here from the left lung, oxygenated, coming into the left atrium just here. Okay, left pulmonary artery we've already seen, and aorta we've seen already. Okay, so all of that we covered last week. Just want to show you this video that we didn't see, which is really cool. So I'm going to have a look at the heart in situ, so as it is kind of in the body. Right, let's just pause that there. So give you a bit of an orientation. So the ribs have been removed. Here we can see the diaphragm. There is a lung, there is another lung, and this kind of yellowy blob in the middle. The reason why it's yellowy is because it's covered in pericardial fat. But it's also part of the connective tissue that surrounds the heart, the pericardium as well. Okay, and this is what I was saying is full of fluid, so that it helps the mobility of the heart. So you've also got layers around the lungs as well, but we'll talk to you about that when we get to the lungs. So and those layers are also full of fluid, and not they're not like swollen with fluid, but there's fluid in between them so that they can glide across each other. But they also, especially with the lungs, they that fluid helps them stick to the underside of the rib cage as well. So as your ribs expand, then the lungs will get pulled with it. So it's like, I think it was Becky when we did this last time, she said it's like having two panes of glass with a drop of water in between, and if you stick the two panes of glass together and then hold the top one, they stick, okay, because it creates that vacuum. And that's exactly the same with the pleura in the lungs. Okay, so they're able to stick to the undersurface of the ribs. So then, as the ribs expand, the lungs get pulled with it, so that they can fill with air. Okay, so similarly with the diaphragm descending as well, so it will pull down, and then so that the ribs can expand. Okay, really quite a clever design. So let's have a look at this. So we're focusing on this section here. So we've got two lungs, obviously. Diaphragm just here. And then this area here is obviously the lungs would normally fill that space. They've been deflated. So, and you can kind of pick up the heart. So the heart is within there, and there's your fat and pericardium. And then there's your pulmonary vessels, veins and arteries. That central line there attaches to the sternum at the front. Okay, so the heart isn't just flopping around. So there, that looks a bit tidier, if I just go back, than this picture. Okay, so this picture, you've got all the fat still remaining in place. And then there, you don't. So now we're down to the pericardium. Okay, so the outer sac, basically, of the heart. So that's the pericardium. There's your aorta. You've got the aorta emerging from the pericardium there, and then you've got superior vena cava with the right atrium entrance just here, and then heart obviously located in that area there. So there they've taken away the pericardium. So now you can see all the way around. So that this is what contains the heart sits in, and you can see it's kind of, so they've obviously just done this. It's very glistening. The heart is covered in cardiac fat as well, so we've got some fat around the heart too, and you can just about make out the muscles underneath. On the previous videos last week, we had the fat removed, and you could see the muscles quite clearly. This structure here, that's your diaphragm. Okay, so the heart is literally resting on the top of the diaphragm, but it's covered in fluid in here. Okay, so it's all like slopping and sliding around, which it needs to, because it beats like 60 to 80 times a minute. So there it is there. So you can move it there. There's your pericardium, so that connective tissue, and then there's the diaphragm just underneath. And the pericardium is attached to the pleura, which is that stuff I was talking about to do with the lungs. There's your inferior vena cava, so it's coming through the diaphragm and then up into the right atrium. And then there's your pulmonary arteries, and then pulmonary vein just there. So you can see how the vessels kind of pierce through those pleural and pericardial layers. So I just thought that was we didn't see that last week. So that's kind of like the real look of this. Okay, so this is obviously connected or surrounded by that visceral pericardium. But look, that's all it looks like on this picture. And when you see it for real, you're like, oh, okay, cool. That's what it is. You can see the yellowy tissue here, so that's obviously fat tissue around the heart. Again, a certain amount of fat is quite normal. There is professor, I think he's a professor, who did the dissections in the Bodyworks exhibition, Gunther von Hagen's. He did a video once of someone with a huge heart, which was just absolutely surrounded in fat, and the person died from a heart attack. So I think they did, well, it was some kind of cardiac related event anyway. And yeah, the amount of fat in that region was just ridiculous. So the one we've just seen, whilst there was fat there, that's quite normal, okay, because you think, oh, you know, but actually, yeah, that's not bad. So I talked about this little bit last week, about there being two circulatory systems, or two main ones to do with the heart. So we've got the pulmonary system. So anything to do with the pulmonary system is the circuit to do with the lungs. So we've got deoxygenated blood coming from the body up here into the right atrium, right ventricle, pumped out, pulmonary arteries into the lungs, reoxygenated, and then back into the left atrium, left ventricle, aorta, back to the body, and then through the capillary network. Okay, so this circuit here where it links up with the lungs, or the heart to the lungs, that's the pulmonary circuit. There's also the coronary circuit, which is to do with the heart itself, so the supply of blood to the heart itself. We'll have a look at that in a sec. And then the systemic system is to do with the body. Okay, so the kind of system, if you like. So we've got pulmonary to do with the connection with the heart and the lungs, coronary, the heart and the heart itself, and then systemic for the rest of the body. Okay, so those are the terms we use for those particular areas. Right, let's have a look at these valves then. So we've got yes, yeah, absolutely right, yeah. So the heart hypertrophies when the arteries are clogged, yeah, definitely, because the heart has to work harder to push the blood through. Yeah, absolutely right. Yeah, you get huge, usually left ventricular hypertrophy. Yeah, that's a really good point. Yeah, that person's heart was ridiculous. It was like 2 fist sizes. It was huge. So it was obviously having to do a lot of work to try and pump blood around. So yeah, we've got, these are the valves that we've just been talking about. So we've got the tricuspid valve, so 3 cusps, bicuspid or mitral valve. We've got the aortic semilunar, and then the pulmonary semilunar. So obviously this one for the aorta, this one for the pulmonary arteries. And then these two are the divide between the atria and the ventricle. So in the real heart, obviously looking like the picture on the right there. Right, let's have a look at these. So this is hopefully the tricuspid valve. There we go. Okay, cool. So, but we mentioned this in the first session about where to place or where doctors place a stethoscope to listen to your heart sounds, and there will be specific points that they can use which will identify specific valves. So the tricuspid valve, if we follow that down here, so you're looking at around about the 5th rib, okay, but next to the sternum. All right, so by the underneath the sternoclavicular joint, just there at the level of the 5th. Okay, so we've got the sternal angle just here in the xiphoid process. So you pop a stethoscope just there, and that's where your best bet is to hear this tricuspid valve and see whether there's any problems with it. Okay, so 3 cusps is your tricuspid, like tooth-like projections. You've got a septal cusp, anterior cusp, and then a posterior cusp. So one that's close to the septum, and then front and back. You can see the papillary muscles, chordae tendineae, just there. So those are your heartstrings, and they attach to the underside of the cusps. So when the papillary muscles contract, and they come from the ventricle walls, then they'll pull open the valves. They also stop blood flow going back, so they'll relax, and then the cusps will shut. So there we go. Yeah, it's an irregular shaped seal. Okay, will close when the ventricles are full to prevent any black backflow back into the atria. Yeah, if they were like just straight lines, then they wouldn't create a very good seal. So they're kind of irregular. So we've got this ridge of trabeculi, which is that what do you call it? Kind of irregular shaped muscle. I'll just pop that there. Just pause that on the next one. Here we go. Yeah. So we've got ridges which prevent the blood from getting stuck in the ventricles. Okay, so that's the point of these. And then as you have a look towards the pulmonary artery, which is then, so if we go back to our thing up here, so we've got right ventricle and then into pulmonary artery there. The vessel walls there are really, really smooth because they don't want anything to reduce the speed of getting the blood out. Okay, so anything any bumps or anything like that will create friction, which will slow down the passage of blood. So that's your trabeculi that we were talking about, so the kind of beams of muscle, and then there they are again, just there. So these ridges of muscle. And yeah, and then this is the different shape here. So smooth muscle near the pulmonary valve. Yeah, so you can see the difference in the architecture of the muscle as you come up towards here. So this is really, really smooth. The rest of it is a little bit bumpy or bumpier. So an infundibulum is a funnel. So we've got this funnel coming towards the pulmonary artery, and then that goes to the lungs. So the blood gets squeezed from that right ventricle up through the pulmonary artery, and then into through this one, pulmonary semilunar valve, and then towards the lungs. Okay, so on that particular video that we just saw, we've just seen the tricuspid valve, and then this one here, the pulmonary valve on the pulmonary artery. Okay, cool. Right, do we want to go to that one? Yeah, so we saw a little video on this last week, which was really cool. So the papillary muscles and then the chordae tendineae. So we were having a look at those working in real life as the heart was beating. So that was really, I mean, that's just a fascinating video, that one. And then here you can see the differences in the size of the heart muscle. So the left ventricle is a lot thicker because obviously it's got a pump to the rest of the body. So that's that systemic circulation. And as Tristan mentioned, if there is a blockage in the systemic circulation, then the heart then has to really ramp up the pressure and push even harder. So this muscle starts to get bigger and then you get a hypertrophy of the heart muscle. And it's then working really hard, but also quite inefficiently as well. So it can create some real problems. And then we've got the left ventricle, the right ventricle just here. Okay, so you can see the difference between the two. So there's the interventricular septum, and then this is the left side, and this is the right side. So again, we saw the differences last week. Right, let's have a look at where's it gone? Let's have a look at this one. So we'll have a look at these pulmonary valves. Okay, so there's your right atrium just there, or where it would be, and then right ventricle, left ventricle, pulmonary valve just here. So you can see, like, top down, these half moon shaped valves, and then in the aorta as well. And then these little areas on the side, these sinuses, so they get to create a bit more space whenever it's needed. So similar to that auricular pouch before. So we've got these swellings on the side here. And then here we can see the semilunar, so the moon-shaped cusps on either valve just there. So they're kind of delicate, aren't they? You know, the job that they do, it's crazy. And there it is there. Okay, so there's your pulmonary valve. It's like some kind of weird alien. And there's the aortic valve. So you've got those three cusps as the blood is being pushed through. And then shut again. Let me just go. Shuts again as it passes through, so it doesn't come back. And there we go. Just pause that there. So that opening there, this will be good for the next bit. So this opening for the coronary artery. So, but this is the aorta. So coming out of this left ventricle towards the rest of the body. So oxygenated blood directly from the heart, and the first place the heart feeds is itself. So immediately as soon as the blood comes through, then it goes into the coronary artery and feeds the heart muscle itself. And that's obviously where we can get some blockages and some problems or some narrowing. So we'll have a look at that in a second. But yeah, that's basically what the pulmonary and aortic valves look like. Little bit of fat around this one. Okay, I think this is probably similar to the image that we saw last time. You've got the aorta and the pulmonary artery. So arteries away. So that's going to the left lung. It's going to the right lung. This is a really good image actually around the back here. I'll just pause that there. Yeah, so that this will be deoxygenated blood going towards the lungs, and then these vessels here, these are pulmonary veins. So that's the left atrium just there. So you've got veins going towards one lung this way, and then veins here going to the other lung that way. Okay, and then that one there, your pulmonary artery. So that's your deoxygenated blood going straight to the lungs to get reoxygenated again. Sorry, that's your aorta, that one there. That's your pulmonary artery. So yeah, and then your aorta pumping out your blood all around the body. So it's all in quite a close space together. And when you saw that image of the heart in the kind of pericardial sac, sometimes it's hard to distinguish which vessel is which. So aorta, pulmonary arteries, superior vena cava. Yeah, so these ones here, let me just pause that there. So we've got a couple of, let's go back there. Just want to get back to that first little opening there. That one just there, cool. So, I think that should say lung. So this little opening here goes to the superior lobe of the right lung. Okay, so we've got a little vessel just there, and then we've also got another little attachment just up here. Let me just pause that there as well. So the ligamentum arteriosum sounds like a spell out of Harry Potter. Attaches the pulmonary trunk to the aorta in the fetus, bypasses the lungs, and closes within the first 48 hours of birth. Okay, so again, we've got another kind of throwback, so some little bit of anatomical history from when we were a fetus in the womb, and it's just a remnants that stays there. We obviously don't need a fully functioning heart when we're in the womb, because we draw oxygen from our mother. So as soon as we're born, the fossa ovale needs to close, and then this needs to close up as well, so that we don't get a mixture of blood, oxygenated and deoxygenated, between the two vessels. So yeah, we've got the ligamentum arteriosum as well. I think that's it for that one. Cool. Okay. Right. Let's just have a look at these. So we've had a look at the valves, had a look at the functions. Yeah. So this is a good little thing to revise from if you're doing any kind of gym or therapy exam, and you have to learn about the circulatory system. People often question why we have to learn this when we do, especially doing like manual therapy. And the reason is you need to know normal, and because you only spot abnormal when you know normal. So if you know the normal function of things and how things should work, then you can quickly ascertain when something doesn't look right. Okay, so yeah, I mean, obviously you're not going to be able to see inside someone's body and work it all out. But also, if someone's got a medical condition, we get questions often as well, as like, oh, someone's got this, you know, a heart valve replacement. Is it safe for me to massage them? Well, if you like don't understand the normal function of the heart and what that valve replacement is, then you can make because it's your profession, you can make adequate adaptations for that individual, depending on whether they've been given the all clear from their consultant to go back to normal life. So yeah, it's up to you based on your knowledge to work out what to do with people. So if we have a look here, yeah, the reason why I left that there for a little bit is because if you want to screenshot it, and then you can kind of chop all these pieces up and then try and get them all in order. So deoxygenated blood, right atrium, tricuspid valve into the right ventricle, then the right ventricle through the pulmonary semilunar valve, pulmonary arteries into the lungs, from the lungs to the pulmonary veins, left atrium through the bicuspid or mitral valve into the left ventricle, and then the left ventricle, aortic semilunar into the aorta, and then from the aorta to the systemic circulation. So that's the whole flow that we've just looked at for the heart. So hopefully that all makes sense. Right, let's have a look at these coronary arteries. Here we go. So remember that little hole that was in the aorta that we saw when it was flapping around, or the valves were flapping rather than the aorta. We saw that little opening for the coronary circulation. So let's have a look at that. So we've got the aorta just there. And like I said, one of the very first places that the heart supplies is itself. Okay, so if I just pause that there. So let's have a look at this picture here. So there's the aorta. There's openings left and right on the aorta. You have a right coronary artery, so one that comes and feeds the right side of the heart, and then a left coronary artery, a circumflex artery, and then that then goes down into the left anterior descending artery. Now that one there is quite important because it supplies blood for the left ventricle. So if you have any problems here with the left ventricle, then obviously it's going to disrupt your blood supply to the whole body, because your left ventricle's not going to be able to pump because it's not getting enough blood. So then it stops working. Okay, so you're in trouble if you have a problem with this left anterior descending, or LAD. Okay, and you may have heard that term before if you're dealing with cardiac patients and read their notes from the doc. So we've got the coronary artery, which was just coming out here. So the coronary artery comes from the aortic sinus, supplies the right atrium, and then goes downwards to supply the right ventricle. Okay, and this is kind of within the gully between the atrium and the ventricle itself, kind of protected in that space. Here we go. So this is underneath. Just pause that there. So inferior vena cava comes up through here, so that would be a right atrium, and this is underneath the ventricles. Okay, so the right coronary artery is coming around and then underneath, so you can see where the blood supply kind of snakes to in terms of supply for that cardiac muscle. So we've got the right interventricular artery that it turns into. So the left coronary is a lot bigger, unsurprising, because it needs a lot more blood. So from the aortic sinus, and you can see already how many branches it's got. We've got a circumflex branch, and then we've got all of these like tributaries of a river. So left interventricular, or LAD, as it's coming down, that's supplying your left ventricle. So again, following the groove between the atria and the ventricle to supply that left ventricle just there. Okay, so what you can kind of ascertain from this, and again, you need to know normal to know abnormal. So if you imagine that you have a narrowing of this right coronary artery fairly close to the terminal branch, so right close to the end, and there's just a slight narrowing, so a little bit of fatty deposit build up, a little bit of cholesterol build up, and it's narrowed that space. Now, because it's down here, it's going to affect this small section of heart. The rest of it will be functioning fine, and it's also the supply of deoxygenated blood back to the lungs. Okay, so in terms of would you notice it or not? Possibly, okay, but it's one that you could probably get away with, if you know what I mean, because it's not impacting a critical part of the myocardium. But if it was somewhere up here at the entrance of that left coronary artery, then it will affect the whole blood supply for the whole of the left ventricle. And so if you needed to run for a bus or something like that, and you needed more blood around your body, left ventricle starts to kick in, starts to pump out the blood, but can't get enough blood itself, then it starts to fatigue really quickly. And then, but then as soon as you stop and you slow down, because it's only a narrowing, you're able to get some blood back in again, and then you're like, oh, I feel okay again now. So that's angina, okay, where we've got this narrowing of the arteries. And the medication you take, the spray or the tablets, they will immediately dilate blood vessels, so that you can get more blood flow, but it doesn't help the blockage, or the narrowing rather. If there's a complete blockage, then that's a heart attack. Okay, so again, like I say, knowing normal helps you understand the pathology. So yeah, if you have a narrowing here, then that will affect the whole left ventricular function. If it's just down here, then it will only affect a small section of the heart, but the rest of it will be normal. So you might feel a little bit of discomfort, but it usually passes quite quickly because the rest of the heart can do its thing. So depending on where the blockage is will depend on where the problem is. And like I said, this left anterior descending artery, the LAD, is a common one that we keep an eye on, especially in cardiac rehab, for example. That is something that you would need to know about. So those are your coronary arteries, and then we saw something called the coronary sinus. So just have a quick look at that. So again, we've got your pulmonary vessels on the back of the left atrium. Oh, I don't think that diaphragm should be there. That's definitely not the diaphragm. So this is the coronary sinus, which is the kind of shallow, the dip in which the coronary vessels will run. Okay, so the kind of gap, if you like, between the atria and the ventricles that we saw previously. There's your opening for the inferior vena cava. So this will be your right atrium just here. And then there's another vessel running underneath there. So that's where we saw the vessels running previously. So the grooves in which the vessels run are the coronary sinus. Okay, perfect. Okay, right. Let's have a look at something different. So what we're going to do is we're going to start adding in some of the vessels from the other areas of the body. So we've had a look at this when we looked at the abdominal region. Okay, so now we're kind of linking the abdomen into the heart. So we're going to have a look at the descending aorta, but also the intercostal nerves as well. So we'll start to bring those in too. If I just pop that on there. So we've seen this image before, or similar. So there's your aorta. There's your heart, lungs have been removed, diaphragm just here and here. There's your xiphoid process and the sternal angle at the bottom there. So this vessel here, this is what we're interested in. So this is your descending aorta, that's your esophagus just there. So the descending aorta is coming off of the arch and then running down through, and it'll pierce through the diaphragms. And when we had a look at the diaphragm before, yeah, so the basically just showing that the esophagus kind of crosses over the descending aorta. And then there's the aorta on its own. We've got these projections coming off of the aorta, the posterior intercostal artery. So they're supplying the intercostal muscles with blood. Just mad, the intricacies of this area and how everything has been supplied by a specific thing. Yeah, so these are the ribs, and then you've got the intercostal muscles in between. And the veins and the nerves will also follow the blood supply. Okay, so when we have a look at those in a second, yeah, so there, that ridge there, that's where the intercostal nerves will track along, and we saw that when we looked at the ribs. Okay, so that's the descending aorta, and then we're going to have a look at the rest of the arteries. So we're kind of linking the heart now to the rest of the body. So there's the aorta again. And then we've got something called the brachiocephalic artery and the left common carotid. So if I just pause that there. So this is literally coming straight from your heart. Okay. Yeah, so carotid comes from carotis, which means drowsiness. So if you obviously block off that carotid artery, you'll make someone fairly drowsy. So there's the aortic arch, descending aorta, which is what we've just seen. And then this here is your carotid artery that goes directly to the brain. Okay, so again, after feeding itself, the next vessel is the carotid artery, and then the brachiocephalic, which again then splits off into another carotid artery on the right side of the body. So yeah, we've got those two branches, and then a subclavian which goes to the arm, so to the left arm. So you've got left arm, head and neck, and then this one, the brachiocephalic, it splits. There's your superior vena cava coming down here. Remove that, and then these are the vessels that go to the head and neck. So there's the manubrium, clavicle, sorry, first rib. Yeah, and then there's the split just there. So there's the brachiocephalic part of it, and then it splits into the carotid and then the subclavian on that right side. So on the left side, I'll just pause that there. So left side, you've got two separate vessels, one that goes to the arm, one that goes to the head and neck. Okay, so they're both split off in different directions. And then this one on the right side is one vessel, and then it splits into two. So it goes one to the carotid up to the head and neck again to supply the brain, and then one to the right arm. All right, so it's a slightly different design from side to side. So yeah, there's your left subclavian artery, which means underneath the clavicle. So again, yeah, the structures in front of that would have been first ribs and manubrium. And then we've got a little branch off there. So internal thoracic artery, that one just there. So that will drop underneath. And there's your subclavian arch. Scalene muscles up here. Yeah, so that little vessel there, that supplies the inside of your rib cage at the front. So we've got vertebral arteries going off as well. We'll talk about those when we get to the head and the neck. This internal thoracic one comes out here, yeah, just there, and that will supply the front part of your rib cage. There it is, just there. Okay, you can see that branch immediately coming off there on that subclavian. So yeah, so this is the inside view of the sternum, and then these are the vessels that come down, these internal thoracic. Yeah, so go underneath that first rib, and then they'll run either side of the sternum, supply all of the musculature of the undersurface of the sternum, all the way down to here. So that's right down to the costal cartilage area. Okay, cool. And then the last thing, just show you this one. Yes. We're probably going to do about 3 sessions on the autonomic nervous system. It's coming up. I'm doing an introduction to it in about 2 videos time. Yeah, so good timing. Right, so let's have a look at this one. So this one's just finishing off the vasculature. So we've got, blimey, things that we recognise: pec major, sternocleidomastoid, clavicle, pec minor, and then here we come, just emerging here. There's your subclavian vein. Okay, so this is the drainage from the arm, and what it will do is it will link up with the internal jugular vein, and then form the superior vena cava. Okay, so that main vein there we go, there it is. So internal jugular and subclavian. There's your first rib. Anterior scalene just here. So that vessel there is going to be a subclavian artery, because the artery goes through your scalene muscles. Top of the lungs just there. Common carotid. So that's what we've just seen. Okay, your carotid artery going up to carrying oxygenated blood. And these are your brachiocephalic veins, okay, on either side there. So coming from the head and neck on that side there, and then from the arms there and there. Okay, so that those two will then join together. Here we go. And if I just pause that there. So from the right side, head and neck, arms coming down into superior vena cava. Okay, and then from this side, it's got a longer way to travel. It's got to go across all of the oxygenated blood vessels. So from head and neck, subclavian on the left side, longer trunk, and then dropping down into that superior vena cava there. Okay, so that's how we get blood back from the upper part of the body, and we've already seen it from the lower part on previous videos. So there you've got both networks connecting together, obviously then with the heart in between. You've got the full circuit. So brachiocephalic, a lot longer on the left than it is on the right, just because of the orientation of the vessels. So there's your right atrium. Yep, superior vena cava is over to the right, so this brachiocephalic on the left is a lot longer. And that's it there. Cool. Okay, everything else I think we have done. Perfect. One more thing, and then we go. So this is introduction to the sympathetic trunk. So what Becky was just talking about the cardiac nerves, this is what we're going to start to get into over the next few weeks. So we've got the vertebral bodies just here. So we're looking at the inside of the thorax. There's a rib. And then there's your intercostal nerves. Okay, just there and there. Yeah, so they provide motor sensation for the intercostal muscles, but also sensory sensation for the chest wall as well. So what's really cool about this next bit is that we're going to see these kind of swellings. It's called the sympathetic trunk. They run alongside the vertebral bodies of the thorax, so only in the thorax, okay? And the trunk has these ganglia, which are increased mass of neurons, and they run like a train all the way down. So there's a sympathetic ganglion just there. And then we've got a link up to the next one, and then a branch off, link up to the next one and branch off. And we're going to talk about these white and grey communicans, or the branches of communication over the next couple of weeks. So some of them go to organs, some of them go to another ganglion, depends on what they do. Some of them are sympathetic, depending on their level, and some of them are parasympathetic, depending on where they're located. Although we have got some papers on that to contest some of those thoughts. Yeah, so these tiny little vessels along here, this is your autonomic nervous system. Okay, so we're going to have a look at that in detail over the next few weeks. Okay, cool. Sorry, ran over a little bit, but we're done. Heart is done. Yeah, so on to the autonomic nervous system, looking at the sympathetics, the parasympathetics, and how the body communicates with the organs and the muscles around the thoracic region. Okay, so we often think of the nerves very much like motor nerves, where things go to a muscle and they activate a muscle. This is now going towards organs, which you don't have to think about your heart beating or your breathing. So these are all automatic functions that we just do not think about, take for granted. So we're going to have a bit of a delve into those over the next couple of weeks. Cool. I will see you next Monday, 10 o'clock. See you then.